Hi, I'm Jeremy Burnham. I'm with Ochsner Sports Medicine Institute in Baton Rouge, Louisiana. I will be speaking about return to play and return to work rates after knee dislocation and multi-ligament knee injury. I have received educational support and speaking fees from Arthrex and Alon Medical, and I'm participating in research that is funded from the Department of Defense. As we know, multiple ligament knee injuries and knee dislocations result in significant amount of time away from work, from sports, and from military duty. In many instances, patients are unable to return to their previous work, their previous military duty, or their previous sporting activities. The timing and the rate of return varies whether you're talking about military duty, civilian work, including types of civilian work, and specific sports demand, including position played, level of competition, and sport that is played. In this presentation, we will explore the literature and look at published rate of return and timing of return data across specific populations. When we look at civilian work specifically, the literature reports a mean rate of 81% return to work. The range is 63 to 91%. A more recent systematic review demonstrated that 73% of these patients were able to go back with minimal or no modifications. The time frame for returning to sedentary work was 8 to 10 weeks, and for returning to more active work was 6 to 10 months. Prospective studies have showed similar numbers. Standard and colleagues demonstrated that patients with PCL reconstruction and multi-ligament knee injury return to work at a rate of 83% with a minimum of 2-year follow-up. Richter and colleagues retrospectively reviewed 77 patients. They found that of those that were not able to return to work, 53% did not return due to knee pain, and 21% did not return due to knee instability. Another retrospective review looked at the difference between return to work among operatively treated and non-operatively treated patients and found that 84% of operatively treated patients returned to work compared to 69% of non-operatively treated patients. Return to military duty has not been as favorable. 2 Level 4 studies demonstrated a 41 to 54% return to military duty after multi-ligament knee injury. This is likely due to the increased functional demands in the military population. Although there haven't been many studies looking at this topic, multi-ligament knee injuries could nonetheless have a significant impact on military readiness. The return to sport rate has varied widely, but in general they're lower than return to work rates. The published numbers have ranged from between 17 to 85%, with a mean of 50%. The average time from surgery before going back to sport has been published between 5.5 and 14.8 months. On the low end of the scale, we've seen that elite athletes return to the same level of sports activity at only 22%, and similarly, military service members return to sports at a rate of 17%. On the other end of the spectrum, Tardy and colleagues found that 82% of patients return to sports at some level. However, only 31% of those patients were able to return at the same level as their preoperative status. Richter and colleagues found that 45% of their patients returned to sports. However, only 57% of those returned to the same sport and 40% returned to a lower level of sports activity. When they looked at reasons for not being able to return to sport, 55% were due to pain and 19% were due to instability. To summarize, published studies demonstrate a wide range of return to sport rates. Many of these studies are retrospective in nature, and they have complex and diverse patient populations that limit our ability to generalize the findings to a broader patient population. A deep analysis of published studies shows that the return to sport rate is probably much lower than 50% and lower than we initially appreciated. It varies significantly based on sport and demand and the level of the athlete. When we look at return to work and return to sports protocols, the literature is sparse. For one, there is not a clear answer in the literature as to the optimal timing of rehabilitation. We hope that the prospective STAR trial will answer these questions in the future. Many of the rehab protocols are based on ACL research, and they start with a recommended 4 to 6 weeks of limited weight bearing and then parallel ACL protocols closely after that. We use a functional battery of testing prior to return to play that is similar to our ACL testing. And now we will summarize return to work, sports, and military duty after knee dislocation and multi-ligament knee injury. Mean civilian return to work rates appear to average 81 to 88% with a range of 63 to 91%. This seems to be higher in operatively treated patients as compared to non-operatively treated patients, and we see a lower return to work rate with a higher KD grade and with vascular injury. Studies have shown an average of 8 to 10 weeks before returning to sedentary work and 6 to 10 months before returning to active work. When we look at military duty, the return to work rates are much lower. 2 level 4 studies demonstrated a 41 to 54% return to military duty rate, and the timing of this is uncertain. Return to sports rates have been the most variable. The range is 17 to 85%, with an average of 50%. However, these numbers are much lower in elite athletes. For example, 22 to 33% of athletes return to the same level of elite sports. We also see a 2-point drop in the Tegner activity level, indicating that they are not returning at the same level in general. We see a higher return to sport rate in operatively treated patients compared to non-operatively treated patients, and the range of time before returning to sports is between 5.5 to 14 months in the literature. Thank you for your time, and I look forward to further discussion after the rest of the talks.